Hello, Dr. Hashmi here, and thank you very much for watching my YouTube channel, Dr. Hashmi Online. This video is about bipolar affective disorder. I've been asked to do this video, and it's one of the major mood disorder. I'm not going to trap myself in bipolar 1 and bipolar 2 and different types of complex diagnoses and terminologies. Bipolar affective disorder is very, very simple. There are two poles of mood, mania and depression. Anyone who touches both the poles, the diagnosis is bipolar affective disorder. So when anyone is in a manic state, what happens? Everything goes up. Our energy is high, our creativity is high, thought process is high, confidence is high, we are active, we do not see the need to sleep, we are fast and very active in doing things. We don't really take care of much social norms. The inhibitory factor which society places on us reduces. So we see ourselves as invincible, far more powerful, far more creative, far more stronger than the fact. And the sense of personal identity goes high. Now, if this state stays constantly for some days, one can class it as a manic episode, and it requires treatment. Then, if the same individual who has experienced this episode of high mood or hypomania or mania develops an episode of low mood, characterized by, again, sleep disturbance, no need to eat, energy level low, sadness, lethargy, body is just a complete wreck, lying in bed, not doing anything, everything is bleak, everything is dark, no point in living, no point to look forward to anything, nothing is bringing any interest to our hearts and minds. That's the episode of depression. So anyone who experiences these episodes, and the duration of these episodes must be for some time. It's not something that if it happens for only a day, we class it as manic episode. If it happens for only for a night, we class it manic episode. No, it needs to be a pattern, a consistent pattern of some days. Individual differences count. We call it as bipolar affective disorder. Now, when bipolar affective disorder is formally diagnosed, where most of the cases are diagnosed with manic episode, because the episodes of depression are usually missed if it is mild to moderate. If it's severe depression and one has developed several episodes of depression previously, it would be diagnosed as recurrent depression instead, unless one develop an episode of mania. Then the diagnosis will be bipolar affective disorder. Now, once it's formally diagnosed with a proper history, defined episodes, and periods of stability and wellness in between, the separation of episodes is essential. then the diagnosis of bipolar is applicable. Once the bipolar is there, it never goes away. It stays with you. But it can go into periods of remissions. These periods of remissions could be very prolonged, may be up to 25, 30 years maybe a lifespan. But the risk is always there. Now, on most occasions, life events plays a very important role. Lot of times, individuals develop an episode either of depression or mania as a result of a life event. Now, the recognition of life events is important, and probably the mental preparedness is necessary. They don't need to take medication forever. It depends on the nature of the bipolar affective disorder. If somebody is developing episodes every year, 2 years, then it makes sense to take medication during the periods of remission. If someone is developing episodes or experiencing episodes after a few years interval, then it's better to be treated when you are ill and try periods of no medication in between. Because there is no point taking medication for 3-4 years when the person could enjoy periods of stability without medication during those years. And if it is linked with a life event, that's important to note, because then one needs to prepare, individual needs to be prepared for the life event. And necessary support needs to be organized so that the life events don't impact as much to lead to a relapse. But there are a lot of misdiagnoses around bipolar affective disorder. One of the common misdiagnoses is autism or ADHD, because in either conditions, individuals are prone to develop episodes of increased energy, but for a brief period, maybe a day or two. So a proper history is important, not only from the individual, but also from someone who knows the patient well. Medication. There got to be a fine balance between antipsychotic and antidepressant medication, because both drugs work differently in brain's chemical system. So you got to have a fine balance. Bipolar affective disorder, depression, is not a standard depression. It does not just respond to antidepressants. You need specific strategies to treat the phase of depressive disorder in bipolar affective disorder, if it is an overall diagnosis. So the first thing we need to remember that the episodes must be defined, separated, periods of wellness in between, and the fine balance of medication, which one doesn't necessarily need to take if the duration between the episodes is longer than a couple of years. This is bipolar affective disorder for you. Thank you.